So I got a question this week about dyspepsia and indigestion, and I was like, I don't have a video on indigestion? How can I not? What are you talking about? But I think that we've just talked about indigestion and all the discomforts that can go along with this dyspepsia issue in so many videos that I've just never actually covered it in a topic. So for those of you dealing and suffering with these issues, I want to apologize for you for not making this video earlier and making you have to suffer longer. And I also want to apologize on behalf of all health professionals. When you see these studies and this scientific literature that I'm going to share with you, I want to apologize that it's been so difficult for you to find and understand this information. I mean, come on.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So when you research this topic of dyspepsia, you find a lot of information about like functional dyspepsia or non-ulcer dyspepsia, and that's because a lot of people will experience similar symptoms as someone who's dealing with an ulcer. And when you look at like the Mayo Clinic, I got some symptoms off of that. And when you're researching the internet and you're trying to find information on this, you see a lot of people talking about, well, you're going to have pain or burning in the stomach. And that burning can come from the stomach acid, kind of on an open wound kind of thing, like a person had an ulcer, but a person can also have this burning if they don't have an ulcer. So that's something that's common to experience, as well as bloating and excessive belching. And when you think about these types of discomforts and this pain, a lot of it can come from these excessive gases that take place, and then those gases will expand your intestinal tract or your stomach, and those tissues expanding can create a lot of pain and discomfort. We also hear about nausea or vomiting, early satiety or fullness, to where you feel like, oh, I've only had a little bit to eat, but I already feel full. Or after I eat, I feel like I'm going to explode. It's not a good time. This girl is obviously not having a good time. So these are a lot of discomforts that can come along with this. We also hear about acid reflux. And dyspepsia comes from a Greek word that really means faulty or ineffective digestion. And even indigestion means a lack of digestion. But something that's interesting is that if you've watched my channel before, you've heard me talk about pretty much all of these symptoms. We've covered each of these symptoms in different videos, and most of these can occur from a lack of stomach acid. Now, there's other issues that can create a lot of these, but a lack of stomach acid can be involved in pretty much all of those. And when you look at this digestive process and you're looking at why would I have a lack of digestion, well, the digestive process starts here. There's things that go on in your mouth. Oh, here comes some enzymes. We're chewing it up. That kind of starts. But the real digestive process starts here in the stomach. And that's where the stomach makes hydrochloric acid to help us acidify our food. Now, that's something that we all learned in the 3rd grade. I don't know why we just tend to forget about stuff. Even I couldn't get my voice back for 8 years, and part of my problem was a lack of stomach acid, and I learned that in the 3rd grade, and I totally just forgot all about that. Now, I did meet Stephanie in the 3rd grade. She was really cute, so there were distractions available. But the point is, the stomach acidifying our food is not a new piece of information to us. So when we put in information into Google and we're doing research on this topic, this lack of stomach acid is called hypochlorhydria. So I thought, well, what happens if we put hypochlorhydria created dyspepsia into Google, and let's see what it says. And Google, the biggest search engine on the planet, like this is not something I got from a Paw Patrol coloring book. This is something that I came off of Google when I put this in there, is they say hypochlorhydria or low stomach acid can cause dyspepsia or indigestion. And it says when the body doesn't produce enough hydrochloric acid, food doesn't break down properly and can ferment instead. This can lead to gas, bloating, and discomfort. And this is pulling from sources like the Cleveland Clinic. And other symptoms of hypochlorhydria include stomach aches, constipation, diarrhea, heartburn, nausea, acid reflux, and early fullness when eating. So these are a lot of the same symptoms that we just saw when we were looking at dyspepsia. And when Google is telling us about, okay, there's not enough acid to break the food down, it has to ferment, Basically, the body's going to figure out how to break the food down so that it can at least get some type of nutrients and some type of fuel. But when there's not enough acid in that stomach, which is very common today, then it can't really break down, so then it starts to rot and ferment to break down. And that process takes a lot longer. So a person might eat another meal and like they're full all of a sudden. Well, the last meal is still sitting in there trying to break down. Body's like, don't send more things down here. I'm still dealing with the last mess you sent down, which is why a lot of people with this issue will either feel full all the time or bloated or have a loss of appetite. But this rotting and fermenting creates a lot more gases, which creates a lot more pressure, which can expand those tissues and create a lot of discomfort. And when we look back at these symptoms, we're looking at the burning that can happen. Well, this burning can happen from a lack of stomach acid. If you look at our video on gastritis, and I'll put a link in the description below, I share a lot of information that shows us that this gastritis actually comes about from a lack of stomach acid, which allows bacteria and other varmints to come into the stomach and set up camp and thrive. So that stomach acid is not just there to help us break our food down, it's also the barrier that keeps all the bad guys from coming in. So we know now that gastritis is usually caused from all of this bacterial creating all this inflammation in the stomach. It's not caused from too much stomach acid like we thought 30 years ago. These ulcers and this gastritis issue is very commonly caused by bacterial overgrowth. And the bacteria is there because there's not enough stomach acid to fry them when they come in. So when we look at what else Google has to say about this, we see that to diagnose hypochlorhydria, a patient could take a capsule of hydrochloric acid after eating. If they don't experience a burning sensation within 30 minutes, they need additional stomach acid. And that's believed by a lot of people. I don't really hold that. We find that that can create a lot of trouble because if someone has a bacterial overgrowth in their stomach, the waste from that bacteria can be very alkaline. So now the stomach is a very alkaline environment. And if you put acid in there that mixes with that alkaline waste, it can create like this fizzy mess that almost feels like a warming or just magnified discomfort. And the person will feel worse when they put that hydrochloric acid capsule into their stomach and like, oh man, that makes me feel worse. That's not something that I need. So we don't find that that's a good way to really figure out if someone has hypochlorhydria or not, but a lot of people do believe that. But when Google says some ways to manage the hypochlorhydria include taking natural enzymes to help digest the food better, changing medications that reduce stomach acid levels like proton pump inhibitors and antacids, and taking herbs that help the stomach produce more stomach acid, as well as reducing stress levels and getting enough exercise. And we've talked a lot in other videos about how stress can push a person into that sympathetic fight or flight state, and for the body to be able to produce hydrochloric acid so that it can break down its food, it really has to have that autonomic nervous system more in the parasympathetic rest and digest side. So if someone's really stressed out, it can basically shut down their digestive process and create an inability to really acidify that food and break it down. And we're seeing here that with that hypochlorhydria or a lack of stomach acid, that creates all of that discomfort and excess bloating and all these other gases from that fermentation process. So when we dig deeper into the literature, I found this study on long-term prospective study of H. pylori in non-ulcer dyspepsia. And they say that 4 weeks after treatment of the H. pylori, and they were basically looking in this study to see, does improving an H. pylori infection improve these dyspepsia symptoms? And they say 4 weeks after treatment, the mean symptom score improved in those with eradication or persistent infection. At 1 year, those with persistent H. pylori infection had a higher score than those remaining clear of the infection. So those who still had an infection, because an H. pylori infection can be very difficult to fully eradicate, so those that got rid of it had a lower discomfort score, and those that didn't had a higher score. And these results suggest that H. pylori plays an important role in the symptoms of non-ulcer dyspepsia. And my viewpoint is, well, that H. pylori infection in the stomach occurs because there was a lack of stomach acid in the first place. That's how that infection comes in and starts to thrive. When the stomach is really acidic enough, that infection can't really thrive there. It's not the right environment for them. And to take it a step further, a lot of people talk about how H. pylori kind of can consume our hydrogen and remove our ability to make that hydrochloric acid. So just having that infection in the stomach can lower the body's ability to acidify the stomach. Not to mention, if any waste from bacteria is alkaline, that's further alkalizing the stomach and further reducing the ability for us to acidify that food properly, which leads to the body needing to ferment it and allow it to rot, to really break down. So that makes sense to see dyspepsia higher with the symptoms when there's an H. pylori infection. But here's where the confusion comes in. Here's why we don't hear about, oh, well, do you have an H. pylori infection? You should check that out if you're having dyspepsia symptoms, because we see this other study on H. pylori and dyspepsia. And this study, the findings they had were there is no doubt that H. pylori is not a sufficient cause of non-ulcer dyspepsia, because it is well documented in the literature that dyspepsia can occur in the absence of infection, and infection can occur in the absence of symptoms. So there you have it. H. pylori is not the cause. Sorry about your luck. And the reality is that in science, a lot of times it just seems like they're looking for an answer. And the reality is, with most symptoms and most health issues, there can be a variety of underlying causes that create the same problem from person to person. So the same person can be dealing with the same symptoms or the same health issue or the same diagnosis, and the underlying cause for that problem can be different from person to person. So this study is showing us that improving H. pylori really improved the scenario for a lot of people, but since it didn't improve it with all people, and since H. pylori can exist without those dyspepsia symptoms, then that's not a cause of the problem. So if the problem is H. pylori for this guy, sorry about your luck. You don't get to find your answers because it's not the problem for every guy. So in this study, I've talked about this in another video, where mealtime supplementation with betaine HCl for functional hypochlorhydria. So in this study with the participants, they basically created hypochlorhydria by giving all the participants a PPI to turn off stomach acid so that they can test what happens when there's low stomach acid. So in this study, they said that this extended mealtime postprandial hypochlorhydria may contribute to poor protein digestion, reduced micronutrient absorption, increased risk of dysbiosis, SIBO, or other symptoms associated with functional dyspepsia. So they're saying that with this lower stomach acid, we're seeing a lot of these problems that we just kind of talked about. Of course, there's an increased risk of dysbiosis and bad guys coming in. There's no stomach acid there to wipe them out. Of course, we're going to have an increase in these symptoms associated with dyspepsia, because most of those symptoms seem to go along with low stomach acid. They also say that, therefore, based on this progressive functional hypochlorhydria in older subjects, it is not unreasonable for integrative and functional medicine clinicians to consider oral supplementation of gastric acid in the form of betaine HCl, often with pepsin, to help reduce mealtime stomach pH. So basically in the study, they found that the people did much better when they were dealing with this hypochlorhydria. It was hypochlorhydria that they created, but doesn't that make sense that this could also work for someone who had hypochlorhydria that wasn't taking a PPI? There's a lot of reasons that someone's stomach acid would go low, or they would have an inability to really produce a lot of stomach acid. They don't have to be on a PPI for that to be the case. But they found in this study that they did a whole lot better when they supplemented with betaine HCl. And one thing that I will say is they said in the study that it was often with pepsin. A lot of betaine HCl supplements that you find out there will contain pepsin. And we actually talk in my books and courses about trying to use an HCl supplementation that does not contain pepsin, because a lot of people need to work up to a higher dose to really acidify the stomach properly. Like the stomach makes the equivalent of about 5 HCl capsules. That's about what a normal human stomach would make in a meal when it's working properly. So if a person had to increase their supplementation up to 5 capsules, if they're using pepsin, that can create a lot of discomfort to have that amount of pepsin. So I'm not telling you to take 5 HCl capsules. I'm just saying we hear from a lot of people that do that, and if they're using an HCl that contains pepsin, it can create additional discomfort as well. And the most interesting thing about what we're seeing here is the most common step that anyone in the medical profession is going to take with someone who has dyspepsia seems to be that the person is either going to get a PPI, where they turn off stomach acid more, or they're going to get an SSRI, which is a low dose of a anti-depression medication, and that seems to help turn off the sensors that are sending these pain signals so the person doesn't experience as much pain. And I know that you're going to go down in the comments and say, yeah, but just turning off those pain receptors doesn't do anything to fix the actual cause. You're just turning off the person's ability to listen to the signals that the body is sending them. And then I'll be like, yeah, I agree with you. I'm not the one who's prescribing them. I'm not a doctor. So good comment that you put there. And I also found this case study for nutritional interventions for gastroesophageal reflux, irritable bowel syndrome, and hypochlorhydria. And this was a case study that it was just of one woman, but she was diagnosed with dyspepsia, and she also had these other issues that she was dealing with. And she also had some gastritis, which is inflammation in that stomach. So with her, they took steps to improve that gastritis, and then they started to implement supplementation with betaine HCl, which helped her improve the pain that she was experiencing after meals. So she was able to acidify her food correctly, so the food didn't have to rot and ferment and create all those extra gases and pressure and discomfort. And this is just a single case study, but it was interesting because I found this in the literature, and it was interesting because in this case, the woman also stopped using betaine HCl for a period of time because she was taking an antibiotic to deal with a sinus infection. And when she stopped the HCl, all of her discomfort came back, and then when she went back on the HCl, all of the discomfort went away again. So again, this is just a single case study, but these are the type of comments that we hear from people in the comments section of our videos on a daily basis. Every day we hear from someone who improved their digestive symptoms by helping the body function the way that it's supposed to function. The body's supposed to acidify food. And in this study, we see that they say PPIs were first thought to have few side effects. New evidence, particularly with extended use, has revealed a decrease in absorption of some key vitamins and minerals, gut dysbiosis, rebound stomach acid hypersecretion, increased reflux-like symptoms, and hypogastrocnemia. And they go on to say the current use of PPIs often focuses primarily on symptom management rather than addressing treatable factors that have contributed to the gastroesophageal reflux, gastritis, and even peptic ulcers. So that's not meaning that I'm telling you to stop taking any acid reflux medication. That's certainly not my place, and that's not what I'm doing. But we understand now that things like acid reflux are caused by a lack of stomach acid. There's a valve here at the bottom of the esophagus called a lower esophageal sphincter that's supposed to open so food can come in, and then it closes once the stomach is acidifying that food. But that valve is triggered by stomach acid. So if there's not enough acid, it's not going to trigger that valve to close, and then the small amount is going to come back up and create that reflux symptom. So if that's new information to you, we'll put a link in the description below for our video on why do I have acid reflux. I'm not going to go into that a lot. But this lack of stomach acid has the ability to create a lot of those symptoms. And the problem is that's not the only possible cause. If someone has a major bacterial overgrowth, either in the stomach or the small intestine, that has the ability to create a lot of those symptoms as well. Also, there's bile that's made by the liver, and then it's stored in the gallbladder, and that bile is supposed to come down once the acidified food leaves the stomach, and that bile is supposed to help us neutralize those acids and also help us emulsify or break down our dietary fats. And if those dietary fats can't be broken down, they can also create a lot of extra gases and discomfort and toxins and junk that just shouldn't be going on. So a person could be having a lot of these symptoms and discomfort from a lack of bile flow. So you can see there's a variety of malfunctions that can happen with this digestive symptom that can create a lot of these symptoms that we're talking about when we're talking about dyspepsia or we're talking about indigestion. Either of those sides of digestion can be a little bit broken. So when you're looking at the steps to improve this dyspepsia issue, the first thing is if there's gastritis type pain, that has to be corrected because you don't have the ability to improve stomach acid function if you have a lot of inflammation in the stomach. An increase in that stomach acid is going to create a lot more pain because it's like acid on an open wound. So a person would want to correct that, and I'm not going to get into that in this video, but I'll put a link in the description below for our video on gastritis because that gives some steps that can help improve that issue. And in that case study that we just looked at, they improved her gastritis issues before they implemented HCl. If they would have just given her HCl, that would have really magnified a lot of her symptoms and made things a whole lot worse for her. The next step would be to reduce any bacterial overgrowth, and whether it's H. pylori or some other type of bacteria or some other type of varmint. You know, there's always yeast, mold, fungal type issues, candida, things that can come in and create trouble as well. So a person might test for H. pylori and be like, oh, that was negative, but they might have some other critter in there creating a lot of trouble. So taking care of any type of overgrowth is important to do, and then correcting any of those digestive malfunctions. It's very common for someone not to be making enough stomach acid, and it's very common for someone's bile to become too thick and sticky to flow correctly. And either of those sides of digestion not working can create a lot of these symptoms. So if you need to know how to improve those issues, my book, Kick Your Fat in the Nuts, chapters 3 and 4, kind of walk you through figuring out which aspects of digestion are not working and what steps you can take to help improve those issues. And the book is available on Amazon, but I'm going to put a link in the description below where you can get the whole thing totally for free. And then you can just jump to chapters 3 and 4 and understand the steps that might be able to help you figure out what's going on with you. Because it really can be different from person to person. And you can see when we're looking at these studies, they're like, oh, it's not H. pylori. If we can figure out how to stop looking at the symptom that the person is dealing with and start looking at the person, then we're going to have a whole lot more luck improving people's situation. And since it's so common for people with a lack of stomach acid to have some type of overgrowth in the stomach or small intestine, you can jump over right now and check out our video on 4 steps to wipe out bad bacteria in the stomach. I can't wait to hear about your results.